Signs some federal stimulus might be in the offing.
Marketplace Morning Report is supported by the United States Postal Service, offering postage stamps for purchase at more than 40,000 supermarkets, drugstores, office suppliers, and wholesale clubs. And by GEP, helping transform supply chains with strategy, services, and software, including GEP Smart and GEP Next, AI-based digital procurement and supply chain platforms.
I'm David Brancaccio. The latest effort in Washington to prop up the COVID-battered U.S. economy seems to be gathering energy. In focus, a $900 billion proposal from a bipartisan group of senators. Marketplace's Nova Safo is here. Nova, the Federal Reserve has been calling for stimulus. How real is this Senate move?
Well, we're past the election now, and President-elect Biden is supporting the proposal as a starting point for more aid. He said it wasn't the answer, but was immediate help for a lot of things, as he put it. Not exactly a ringing endorsement, David, but it's significant. Also significant, some apparent concession from Democratic congressional leaders. They called the bipartisan proposal the basis for new discussions, which is a big deal because it's nowhere near what they'd wanted before the election, which was well above $2 trillion.
Now, this proposal stays below the $1 trillion mark. What is in it?
Well, the headline number is $300 a week in supplemental unemployment benefits. That's just half the previous amount in the CARES Act. People were getting $600. Also, there's money for housing and food assistance. There's $160 billion for state and local governments, more money for the Paycheck Protection Program, and a host of other items, such as schools and airlines.
It would have to get through the Republican-controlled Senate. What are the bosses there saying?
Well, we know that Mitch McConnell is not supporting the bipartisan proposal at this point. The White House hasn't come out in support of it either just yet. But both McConnell and Biden have said they do want something to pass now before Congress leaves town for the holidays and then debate more relief later.
All right, Nova, thank you. There's word just now that in the last week, 712,000 more people signed up for unemployment benefits after fresh layoffs. That's A, very high, B, lower than the previous week, C, they have trouble seasonally adjusting that figure during this COVID holiday season. There's a new report on coronavirus and the workplace. According to the Urban Institute's numbers, Black, Latinx, and Native American workers are particularly vulnerable to infection on the job. Many are in industries considered essential or work in service industries in states with fewer COVID restrictions, with the CDC now looking at guidelines for which groups would get vaccines earlier. Marketplace's Megan McCarty-Carino has more from our Workplace Culture Desk.
More than half of Black, Latinx, and Native American workers have jobs that put them at a greater risk of getting sick, says report author Lisa Dubé.
That likely is part of the reason why you have much higher rates of cases for these same populations.
That compares with about 40% of white workers whose jobs put them at risk. She also found workers in the higher risk groups were more likely to lack health insurance, depend on public transit, and live in multi-generational housing. That increases the risk of disease spread. Dr. Helene Gale is one of the co-chairs of a scientific committee providing guidance to the CDC. She says all these factors must be taken into account when deciding how to distribute vaccines.
Doing it in a way that really does look at who's at greatest risk, who's most vulnerable, who's most likely to develop severe disease.
The CDC is working on a plan to roll out vaccines as hospitalizations for people with COVID-19 surpassed 100,000. I'm Megan McCarty-Carino for Marketplace.
Marketplace Morning Report is supported by Omidyar Network, a social change venture that is reimagining how capitalism should work. Learn more about their efforts to recenter our economy around individuals, community, and societal well-being at omidyar.com. And by C3.ai. C3.ai software enables organizations to use artificial intelligence at enterprise scale, solving previously unsolvable business problems. Learn more at C3.ai. And by Avalara, simplifying sales tax compliance with cloud-based solutions. Avalara automatically integrates with more than 700 of the most widely used ERP and e-commerce solutions. Avalara, tax compliance done right.
Grocery chain Kroger reports sales and profits this morning. Kroger, which is also Ralph's, Harris Teeter, Fred Meyer, and many more, is offering rapid antibody testing at its pharmacies. These can indicate coronavirus in the recent past, but are different from active infection tests. The line between grocery stores and healthcare is getting finer, but may blur further as the vaccines start coming. Here's Marketplace's Sabri Benishore.
Millions of Americans are spending a lot more time at home, including a lot more time eating at home. Grocery stores have benefited.
Especially as restaurants have been restricted or in many cases closed.
Zan Akbari is an equity analyst at Morningstar.
As a result, Kroger has seen a significant uptick in its sales, both through the first and into the second quarter.
That's great for Kroger. David Livingston is with DJL Research. He says it's also not great for Kroger.
I mean, it's not all rainbows and unicorns just because your sales go up. Probably you've lost some employees. You're looking at paying overtime. You're trying to add employees for the increased sales. You've had to prepare your stores for the pandemic.
So it is perhaps no surprise that Kroger is offering antibody testing at its pharmacies. It's another way to get people in the door. And health and wellness is already a major part of the chain's business model.
Tell you, some of these stores, sometimes they'll do 20% of their total sales just in the pharmacy.
If consumers associate Kroger with COVID-related testing, that could actually be very handy when a COVID vaccine rolls out. Greg Portell is with A.T. Kearney's Global Consumer Practice. He says the vaccine or vaccines are an opportunity for big retailers in general and grocery chains in particular.
There have been discussions about grocers and retailers being involved in the vaccine distribution. I mean, obviously, they provide a lot of points of access, which is important when you start talking about vaccine distribution.
Grocery stores have the ability to transport goods in cold storage already. Some vaccines require very cold storage. And pharmacies, which are sometimes inside grocery stores, already provide flu shots. So if people start heading in droves to the grocery store for their COVID vaccine, an industry that was able to succeed as the virus emerged could benefit all over again from COVID's demise. In New York, I'm Sabri Benishore for Marketplace.
Checking markets, the S&P future is down a single point. The Dow future up 22 points, less than 0.1%. The NASDAQ future is up about 0.1%. I'm David Brancaccio. This is the Marketplace Morning Report. From APM, American Public Media.